Hello, students. Today, we're going to talk about club drugs. Now, club drugs is not necessarily a drug category or a drug classification, but I do want to talk about the generalization of club drugs because they are certain drugs that have become popular among teens and at clubs and at raves and at dances. So they are popular, and I do want to talk about each and every one of these: MDMA, ecstasy, rohypnol, ketamine, and GHB. Um, they are considered club drugs, even though it's not a classification. So I'll talk about each one, like MDMA and ecstasy are considered a hallucinogen, rohypnol a depressant, ketamine a depressant, and GHB being a hallucinogen as well. So starting with ecstasy. Ecstasy is slang. Um, the main ingredient in ecstasy is MDMA. Some people might also call it Molly. That's another slang. Molly has a little different chemical substance in it, but essentially MDMA and ecstasy and Molly are the same drug. MDMA is synthetic, so that means it's not growing out of the ground. Okay, MDMA and ecstasy are man-made, and they're made illegally in labs. Other chemicals are also added to it to give the user that high, and different ecstasy pills have different chemicals in them because they're man-made. You don't know who's making them. You don't know where they're coming from. It's not professionally made, like a prescription by the government. It is man-made by somebody, down by the river in their shack. Ecstasy, it's mind-altering. It is considered a hallucinogen. It's going to mix up pictures in the mind and throw people into scary or sad experiences in the past. And it increases the perception of color, sound, and sensations. One hit of ecstasy is going to last 3 to 6 hours. Once swallowed, it takes 15 minutes to enter the bloodstream and reach the brain. And after 45 minutes, the user reaches peak high. And then from there, it's all downhill. And the following side effects can occur. So a feeling of sadness, anxiety, and depression is a big one because, like I said before, if you listen to my videos, that dopamine level is down. Memory difficulties, paranoia, nervousness, insomnia, drug cravings, increased touch of sense. So your senses are going to be increased. Suppresses your need to eat or sleep, and then a moist skin or dry mouth. A lot of times, also with ecstasy, a lot of times, their heart rate is going to be increased because of that anxiety or because of that depression, and you don't really feel like you need to eat or sleep or drink any water. Um, and a lot of times when somebody is not eating, not drinking, not sleeping, and they're moving around a lot, for example, like dancing or doing something with a lot of movement, they're going to get dehydrated. If you don't hydrate your body, um, it's going to start to overheat as well. And so a lot of times people will overdose from ecstasy because their body just was overheated, and then their body just couldn't take it anymore. So if somebody was starting to overdose from ecstasy, the best thing you can do is get them in a nice cool bath. Sometimes even an ice bath would help because it does increase that heart rate, does increase um, that chance of being too dehydrated. Moving on to rohypnol. Okay, rohypnol can affect your brain and body. Slang for rohypnol, it's also known as the date rape drug. This is something that a lot of times is slipped into a drink to make the user not remember. I mean, a lot of times it's somebody else slips it into the user's drink, um, just so they can sometimes be taken advantage of. It's very common in a college setting. Um, when I went to UMaine, there was instances of this drug happening, and this drug being used on somebody. So it is around, but Rohypnol is going to damage the neurons in your brain, impairing your senses, memory, judgment, and coordination. It's an artificial drug, a synthetic drug, so it is made in a lab. It is not nothing is natural out of Rohypnol. It's going to make the user feel relaxed, confused, spaced out. It takes away all inhibitions. Okay, so it's going to make people do things they don't normally want to do. They're not going to have really reliable memory as well. It's very dangerous though as well. So the dangers are it could make the user slip into a coma, especially if mixed with other drugs. Like I said, it is used as the date rape drug, as a slang. It can make people unconscious. Don't remember. A lot of times it causes amnesia. So they don't remember what they did on the drug. And then it most of the time comes in the pill or sometimes in a powder form. But the biggest danger is a lot of times that a user can slip into a coma for a few days and just not remember what happened. Very, very dangerous, and it is very, very still used in colleges, a lot of colleges. Not good. The last club drug I'm going to talk about is GHB, pronounced gamma hydroxybutyrate. Basically, it's liquid ecstasy, if I was to explain it. It has no color, no odor. It is man-made, and it is very, very dangerous because it is in liquid form. And a lot of people miss the doses, or they just don't know how much they're taking, and then they will overdose, which leads to their body overheating and their heart not exploding, but their heart just stops beating because it just beat too fast. Couldn't take it anymore. It's swallowed in liquid or powder form. Sometimes, most of the time, GHB is in liquid form. You see it right here at the bottom. It causes a rush of happy feelings with that dopamine, and it has killed more people than ecstasy only because it is in liquid form and people are overdosing and they don't know how much they take. But side effects can be puking, breathing problems, seizures, and dehydration and exhaustion. Very, very negative side effects from club drugs. Ketamine. This is the last club drug I talk about. Sorry about that. Ketamine it's basically a painkiller for animals. So it's an animal tranquilizer. It's going to produce vivid dreams of hallucinations, and it makes a user feel like their mind is separated from their body. That's called disassociation. So when you feel like your mind is separated from your body, you can't control what your movements are. That feeling is called disassociation, and ketamine is considered a depressant. Like I said, it's used as medicine for animals. It can be in a white powder form, which can be snorted or mixed into drinks, sometimes smoked with other drugs. When it's liquid, it's typically injected, and then it dissolves when slipped into drinks. Negative effects of ketamine. After 1 to 10 minutes of use, they're going to feel drunken and dizzy feeling, numbness of body, kind of feel like a weightlessness, being confused, intense, terrifying hallucinations, loss of consciousness, prevents the user from feeling pain, leads to suffocation by breathing vomit into lungs. So sometimes you're just not able to control your bodily movements, especially vomiting. And if you vomit and you're not able to, or you're not ready for it, and you just vomit, a lot of it will actually get into your lungs, which is not good to breathe in. And it's also going to reduce the level of oxygen in the brain, heart, and muscles, which can lead to death. It can cut off that oxygen to your brain, just like inhalants. All right, we'll move on to heroin another time. Thank you.